am Management Co-Chair Patrick Priest, and it is my pleasure to open this meeting of the Management and Labor Advisory Committee on February 4th. And we have a busy agenda, and we've ended quickly each of the last two times, so I'm going to go ahead and get started right away. I would ask, though, I really appreciate members of the committee going on camera, because then you go to the top of the view, so I can see when people have comments. So thank you, those that are on camera, and those that aren't, I would respectfully ask that you turn your video on. And with that, I would turn it over to Teresa to do the roll call.
Okay. So we'll start with management. So Patrick is here, of course. Tammy, good morning. I see you up in the corner.
Here.
Sarah, yep. You're all, the whole committee's like in a row up there. Okay. And then John, good morning. And Lynn, okay, so we're good there. Let's see. So for the Labor Caucus, Scott is here. So good morning. Matt is excused. Jill is here.
Present.
Yes. Let's see. And Marcy is not here yet. I don't see her. And Margaret, good morning. And Andrew. So we do have quorum.
Okay, thank you very much. The first item on the agenda is to review minutes of the last two meetings, and minutes have been distributed. I would ask if they could be considered together, or does anybody see a reason to divide them out and act on them separately? Okay, we'll act on them together. Are there any changes that anyone has to propose to the minutes as presented? Tammy.
I sent an email with a couple of little changes to, I think it was Brittany and Kara. So if those changes were made, then I have no issues with the minutes.
Yes, Tammy, that was made. And Lynn, your edit that you sent over for the January 21st minutes is incorporated as well.
All right, thank you, Lynn. Did you have more to add to that, or was that resolve your hand raised? Okay. I also submitted like the smallest edit ever, but I gave that to Brittany. Hopefully that's been reflected as well.
Yes.
All right, Ms. Waddell.
Yeah, I don't want to be difficult, but I feel really uncomfortable voting on things that have been changed without having an opportunity to look at them.
Sure. That's a very good point. We could certainly withhold them and vote on them in our next meeting.
Right.
And then have them be distributed.
Yeah, I mentioned it last month because, you know, there were changes, but I wasn't even at the meeting, so it didn't seem like I should really need to see them. But, I was at the meeting. I'd like to see the changes that were made before I vote on it.
Yes, and Margaret, I do apologize to you. Typically, we do include, like with their edits, what the description is during this portion before the vote, so that if it is grammatical error versus something like more substantive. So I apologize. We will do that for you.
No.
We missed it this week.
Right, apologies not necessary. Thank you.
All right, well, it seems as though we should defer this until our next meeting. Does anybody have a dispute with that before we move on? Okay, all right, well, hearing none. Yes, Sarah.
Sorry, Teresa, will they be redlined so we know what those changes are?
Yes, I think we should be able to do that.
Or how will we know what the changes are in the updated minutes?
Through the magic of Microsoft Word. They're not, as I say, either we can do that through Microsoft Word, be able to go back to a prior version and do that, and we can do comments on the date, who made the change, and basically do date timestamps on the suggested changes from the three members. So that you'll have that as well.
Thank you.
Okay, good question, Sarah. And so with that, we will move to the next item on the agenda, which is department updates, and I will hand it back to Administrator Van Winkle.
Thank you.
Which are mute.
Yes. The mouse was not responding to my wish to be unmuted. I'll be brief. Not very much to add to the meeting. In regards to the rulemaking calendar, no changes. The only forthcoming activity from the Workers' Compensation Division is the public rulemaking hearing for Oregon medical fee payments schedule. That is on the morning of February 15th, 2022. I will put the link to the to the upcoming meetings into chat, but if you have any questions in the meantime, for members in the audience, please feel free to send me a private message or an email, and I'll respond to you as quickly as I can. You also have, let's see, and the other items that were sent to members outside of, for follow-up outside of the bills we're discussing today. There is a follow-up memo from DCBS. This is a follow-up from the January 21st presentation of the Permanent Partial Disability Report. Specifically, Scott had a question in regards, there were questions in regards to trends by industries, and so the memo outlines that. And I don't believe, I'm checking to see who's here in the audience, if members have questions specific to the memo. So I don't believe Justin is here. But if so, I can coordinate if there's any follow-up from the report language. And so I think that's really all I have, except for update on the bills and where they're at in the legislative process. We'll do that when the time comes on each.
Okay. All right. Well, thank you very much. Margaret, you have your hand raised still. Is it carryover, or did you have a question on this? No question? Okay. Jill, I see that you have a question, though.
Yes, just at an appropriate time. I wanted us just to bring up the fact that we did have a line of duty death in the firefighter ranks yesterday. And so at an appropriate time, I just asked that we could maybe have a brief moment of silence for them.
Yeah. I think this is a good time now. Thank you for bringing that up. I read about that this morning, and it is a horrible tragedy to lose a life of somebody that's helping others. So I would ask that we all take a moment of silence in their honor. Okay, thank you very much for that suggestion. With all the changes and everything going on, it's sometimes hard to forget about things that are going on in the world. So thank you very much for that, Jill.
Yeah, thank you guys for taking the moment.
Yeah, you bet. So now it is time to move on to our business at hand. We do have 4 bills to consider. 2 are new, and that's what we're going to start with. And Teresa would like to update us on legislative deadline dates and then introduce the first one, which is Senate Bill 1560, related to non-citizens.
Thank you, Mr. Co-Chair. So the deadline for the legislature, for all the bills that are currently in front of MLAC for review, the deadline for those to what's called a work session scheduled is by end of day next Monday. That's really the only thing for generalities. When we get to each bill, I can provide an update on where it's at in the process, although I'm presuming to the proponents for the last 2 bills can speak to that as well. There. I do not know of nobody has signed up, to the best of my knowledge, for this particular bill. However, I do have a document that Senator Jama's office released. It actually was a press release, but there's enough information here for historical context, background, and such that I can summarize it and enter it into the record. So, for that. Let's see. And so Senate Bill 1560, which has its first public hearing next Wednesday, what it does is it corrects the terminology, immigration terminology, in a variety of chapters of the Oregon Revised Statutes. Specific to MLAC, there's two changes in Chapter 656, which is why this is in front of you today. So in 1790 was the first time that the terminology alien was introduced into United States law through President George Washington's approval of the Naturalization Act. Over the past decades, the term of alien has been used to vilify immigrants and asylum seekers who then became targets of danger and hate crimes. Existing federal law, for purposes of various provisions related to immigration, defines alien to mean a person who is not a citizen or national of the United States, and I believe Oregon law has a similar definition of that as well. It does use the term on its own. Actually, I apologize, I take a step back there. The existing Oregon law has various other terms to refer to persons in provisions relating to, amongst other things, education, housing, natural resources, employment, probate law, social services, driver's license, firearm permits, service in the state militia, and criminal punishment. In April 2021, President Biden's administration ordered the United States Immigration Enforcement agencies to stop using words like alien or illegal alien to refer to immigrants. What Senate Bill 1560 does is it revises existing state law provisions to refer to those persons using non-citizen instead of the word alien. There's also going to be a clarification in the intent of the legislature that these changes are only non-substantive, essentially modernizing terminology of that. There are two other states, California and Colorado, who have removed the term alien from their statutes. And I don't know if there's any other state that has similar proposal at their legislature this year. So that's a summary. I'm actually looking at chat. Thanks, chat. I will open it up for stakeholders if anybody is here to speak on the bill. Okay. I believe I summarized enough. I had a potential witness, but I think I summarized the bill enough for everyone there.
Okay, I guess we could open it up for discussion. It does strike me as a housekeeping item. Mm-hmm. I don't know if anyone on the committee has comments, questions, concerns. I see none. Administrator Van Winkle is so organized. She provided me a recommended motion, and so I will read that and ask for somebody to make this motion. I move to support the changes made to ORS Chapter 656 in Sections 13 and 14 of Senate Bill 1560.
So moved.
I second that. Oh.
So I had a motion by, it was a fight to say it, so I didn't catch it. It was Sarah, and then I heard Tammy's voice as a second. So, all right. Is there any discussion on the motion? Okay. Hearing none. All those that support this, please indicate by saying aye.
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 Or thumbs up, I guess. Are there any opposed? Okay, all right. Well, we have supported something. All right, guys. So let's move on to the next new legislation. And this is Senate Bill 1585, Oregon Health Authority COVID-19 data sharing. And I believe that we do have testimony to consider before the act.
We do. And actually, I wanted to... I'm going to go out of turn because the proponent of the bill is not on the list that was sent, but she is here in the room to speak. So, Jess, not to put you on the spot, but I'm presuming you want to talk to your bill.
Sure. I wasn't sure if we were still doing it after our text in the morning, but sure, happy to. Jess, Jenny Tina Villadeboro, she's our Oregon AFL-CIO. This is a bill that we worked closely with SAFE on for months to do without legislation, and really want to thank DCBS for being a willing partner and trying to solve for this problem for that whole time. And essentially the problem that we're trying to solve for is workers' families who historically probably would have been notified that they were eligible to file for workers' comp death benefits, don't know that they're eligible because of the way that the notification process isn't occurring in light of COVID. So typically when there's a workplace fatality, employers are required to notify Oregon OSHA of that fatality. And then Oregon OSHA has worked with language with the Ombudsman Office to notify the families that they're sorry for their loss and that their families might be eligible to file for workers' comp death benefits. And then it lists the Ombudsman's Office as the contact if the family has questions about filing for comp death benefits. Employers are not notifying Oregon OSHA of COVID-related fatalities for numerous reasons, and I'm not here to argue about that. I am here to ensure that data that state agencies have access to is shared so that we can notify these families. So since June of 2020, the Oregon Health Authority has been aggregating and publishing workplace outbreak lists. That data is not perfect. It only captures 5 or more cases in places of employment that employ 30 or more employees. And they aren't always employees, as many of you know. For example, it could be an organ player at a church is an employee and he has tested positive. But 5 parishioners also test positive. That church will show up on the list as a workplace outbreak. But what we do have is a list of 168 individuals who have died as a result of a workplace outbreak. And, through conversations with OHA, the Employment Department, and DCBS in the last 24 hours, we think that we have a path to ensure that data is shared just so the initial notification can go to families who were employed at the time of their fatality to notify them that they can file for comp death benefits. Nothing changes about the comp process that those families will have to go through to prove workplace exposure, but we want to give those workers' families a chance to be able to know that they are maybe eligible to file for comp death benefits. This was always we have this data, we should solve for this problem that we haven't heard about yet for about 6 months. And then a couple months ago, we were notified of a worker's family who had no idea, their mixed documentation status family, but no idea that they could have filed for these benefits and suffered significant financial harm as a result. And as you all know, these fatalities and contractions are being processed currently as injuries, and I'll let David talk to the timeline, but arguably there's about a 1-year window that these families have time to file. So our hope is that you all will support the bill and that the legislature will pass it to ensure that this notification goes out. Happy to answer questions.
Are there any questions for our speaker? I think it was well laid out. Thank you very much. I think we'll hear. There's additional testimony. I think it was referred to by Jessica.
Yes.
Teresa, I'll let you.
Yeah, I was going to say, yeah, Dave. And then I can
announce
also
the next
provide an
one.
update too from the DCBS end of this as well. After David.
Dave Berenberg from SAFE, and with me is Holly Odell, our legal vice president, who can answer questions better than I on this. But the base is we just fully support workers' families knowing of their rights and the process for filing comp claims. And as Jess said, that what this bill seeks is just to inform families, and then if they choose to file a claim, it goes through the normal process. We fully support this, and as Jess said, generally claims can be filed, for a year following the death. And as with most things in comp, there's usually an asterisk that can create special circumstances. So we're happy to answer any questions. We're hopeful that, with the agency's efforts and working together, and thank you to DCBS, that these families will be fully informed, and happy to take any questions.
Are there any questions for our team from SAFE? Well, I think it also was well laid out. It seems pretty straightforward as well. Our stakeholders are in agreement. How about members of the committee? Is there any discussion, any comments, concerns, or questions from anyone on the committee? Thank you, Sarah, for shaking your head. You're always so clear, by the way. Thank you for that. Anyone else? Okay, I'm hearing none, so it seems as though we could take a vote on this one as well.
Well, I actually,
Teresa, is there a motion that you'd like to propose for us to read?
There is, except I want to provide an update as well, just where the bill is at in the legislative process. So it does have a hearing, had its first hearing yesterday. There's a work session scheduled for next Thursday. I believe it's on the 10th. I don't have the calendar for me too, which that could be off on what day of the week it is. I'm changing my hat from MLAC administrator to DCS legislative director. I am working with Jess and Senator Taylor's office in working on an amendment to the bill, essentially just to and please Jess correct me if I misspeak, but it's to provide some accountability for the agencies that will be involved in carrying out the legislative intent of this bill. And then also, one of the ideas as well, and again, we're still in conversation, we're in very early conversations about this, but we have to get it hammered out like ASAP for the work session. But one of the thoughts is the bill currently places, if the bill becomes enacted, the language we placed in Chapter 656. But the thought came up internally within the director's office that perhaps the bill could be placed in another chapter. There is a chapter in ORS specific to DCS operations, or it can stand alone as Oregon law. And the primary reason for that is because the plan is going to go to obtain the data, process the data, and issue notifications, is that it's actually centralized in the Office for Oregon Workers, which is not within, it's actually within the director's office. So that is the thought of doing that. As soon as I know what the language will, what's going to be contained in the amendment, I can send it to to all of you. And if the amendment places the bill outside of Chapter 656, MLAC does not need to do a vote per se. But if you wanted to do like a statement for the record, something of that nature, that can work as well. And co-chairs, I can work with you on next steps in that regard. But I want to just give you all of you a heads up on the potential of it, where we'll land.
So it sounds like it's something that can wait until next week, or it would have to be done in advance of that. Okay.
Yeah, I think.
Right. I see a couple of hands raised. I'll let the members of the committee ask their questions. Tammy, you're first on my screen, so I'll let you go first.
I was just going to ask Teresa, would it help for your meeting next week to know yes or no if MLAC, supports this? I mean, I support this, and I'm assuming everybody does, but would it be helpful for you guys to know that when you go into your meeting?
I think so. The legislative intent is not going to change. So the language of the will not change. It's more just frankly, it's accountability. Because if there's, for example, if there is an obstacle for my agency to obtain data, then we may again, it's for accountability and also probably outcomes as well. But again, there's moving parts. There also needs to be discussions with Senator Taylor, of course, for sign off on the amendment language, and Jess, of course, because it is her bill. So.
Okay, good question. How about Sarah? You had your hand raised as well.
Teresa, could we just, formulate the motion in a way that if it stays in the statute, that we support it? But just supporting it regardless, yes. I don't think it will hurt, even if it moves.
No,
is that correct?
I think that's good. I think it's
good. Okay, I would rather do it today and get it off our plate if everyone is in agreement.
Thank you, Scott, for nodding your head so much. Thumbs up. So. Is it something that would be agreeable, Teresa, to just ask for a vote to support the bill that was presented?
Yes.
And
yes, and
then just leave it at that and then vote on it?
Yes.
Would that be helpful?
I think so. And what we can do too is that I can provide an update next week next Friday. And if there is something else for MLAC to vote on that work, yes, we can do a separate vote. If not, I anticipate that this will be the only vote. So,
Okay. Well, I would entertain a motion to support Senate Bill 1585 as presented.
So moved, Lynn.
Scott Strickland,
Lynn, thank
seconds.
you. Okay, Scott, thank you for seconding. Any further discussion on this? All right, hearing none. All those that are in favor signify by saying aye.
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 Any opposed, please say the same. Okay, hearing none. We have our second area of agreement. And with that, we move into reconsideration of two bills we've already looked at. And I did receive a request this morning from the Labor co-chair to pause for caucus meetings. 5 minutes, I'm going to say 10. Let's give it 10 minutes for our caucuses to meet, and then maybe for Scott and I to talk a little bit beforehand before we reconvene. And so that we do have Zoom caucus meetings that Teresa has sent out, and everybody should have received that. I will have my caucus, go into the management one. Does anybody need any instruction or any information about how to access that? Okay, hearing none, I guess.
I do. I don't
So we
see.
just
You do,
need to go
John?
back
Okay,
and
John,
find the email.
Yeah, I have it, and I can
Okay.
send it out to everybody. And I will do that as soon as we take our break. And that's not something, Teresa, that we can click a button in here and say, go to a management caucus room. I know there's
no, you would have
some
to,
Zoom meetings have that fancy kind of capability. We don't have that, do we?
not for
No,
this
we just have to
particular-
sign into another meeting.
Yeah, we just sign to another.
Just to be clear, we have to sign out then, right, of this meeting?
Yes.
Okay.
Yes.
I
So we
think
have to
so.
leave, I believe we
think
have to
so.
leave this meeting and then go into our caucus meeting and then come back.
Yes, we.
Gotta go old school.
Yeah, it's not set up as a breakout room, so because the Zoom information you have is for a what's called recurring meeting, so the caucus can use that at any time without, even separate from MLAC.
All right, Tammy, I see your hand raised, so before we break, I'll let you talk, and I'm going to look for that.
I was just going to
link.
say I
I
don't
put
see
it in
the
the chat.
email.
Okay.
I don't see the email with the link, so I was just going to say I don't see it in here.
Tammy, I have it, and Patrick, let me just send it real quick. I have it up.
Oh, good. Thank you.
Okay, great. Thank
I was
you.
gonna say
Thank you very
the
much.
other option, I should be able to, since I'm logged in, copy and paste, and I can do private messages as well. Because I do, yes. Okay, so Margaret, I know John needs it, okay.
Teresa, I'll send out the management one.
Okay, thank you.
All right, well, thank you very much. It's 10:28 according to my clock. If we give, let's say 12 minutes and reconvene at 10:40. And so with that, I will call a pause to the meeting for caucus, reconvening at 10:40, and will sign out myself and join back. All right, I'll talk to some of you soon. I believe we have all members of the caucus who are available today online and ready. And thank you for being on video, those that can. And so with that, I would reconvene the meeting, ask to reconvene the meeting and enter in committee discussion and start with House Bill 4113, Firefighter Cancer Presumption. And would just, we've heard from stakeholders and had lots of discussion about it. We've heard from the legislator that is proposing it. And now it's time to hear from committee members. And I see that Lynn has her hand raised. So we'll start with her.
Thanks, Patrick. I've been struggling, and I think my colleagues have too, in trying to get to yes on this proposal. So I just want to share my thoughts about presumption generally, and what I'm struggling with in going to try to say yes to this bill. Presumption, I'm not a fan of it, and I think there are several of us who are not, because a presumption for a specific group of workers on its face kind of tips the balance in the workers' comp system. It switches the burden of proof from the employee to the employer and gives some workers a benefit that others who may have the same illness don't have. So when you put a presumption in place, as we have in the past and are being asked to expand now, it has to be for a compelling reason. So I think that's why we look to data to provide evidence to help us understand why we're making that kind of change. In this case, we've been presented with some data that is suggestive but not terribly conclusive. But for me, having been involved with firefighter cancer presumption since the 2007 session, when I was in the role that Patrick has now, I've come to believe that conclusive data about cancers linked to firefighting didn't exist then, and it really doesn't exist now. And we can't make that data just materialize. So I was talking with Carl Koenig earlier this week, and in the course of that discussion, he told me about a National Firefighter Cancer Registry, and I looked into it. It was apparently established by NIOSH in 2020, and it's to gather the specific data that we're looking for to support House Bill 4113. But according to NIOSH's timetable, they don't expect to have reportable data until 2024 later. And this issue is obviously not going to wait until then. So knowing that, I think there's a couple of things that would help me move forward to say yes on this, and I think for some of my colleagues as well. The first is knowing what we can expect in the future. When the 2009 cancer presumption was passed, my understanding anyway was that the proponents had said they were not going to be coming back for more cancers. And it's a number of years later, but here we are. So I think the logical question is what's next? And it would be good to hear from proponents on the record what their intentions are and if there are other cancers they expect to be bringing forward. So we have a bigger picture. And if we all agree that at least ideally, presumptions for occupational diseases should be based on data, then I think MLAC should go back for another look, even though I won't be a member, but I think MLAC should go back for another look once the NIOSH data is available. We think there would be a benefit to the workers' comp system if we agreed as part of this process that MLAC formally decide to look at the data once it's available and potentially report to the 2025 legislature about what the findings are. So those are my thoughts, and I know we'll have additional conversation, but thanks for the chance to share that.
Thank you, Lynn, for the very thoughtful comments. And I see another hand raised. Thank you, Jill, for speaking up. We'll yield the floor to you.
Thank you very much, Patrick. Lynn, that was really helpful for you to share some of the sticking points, especially for you personally. I wanted to just share a couple points that have really been kind of resonating with me pretty strongly over the last week or two. And I can appreciate Lynn bringing up wanting to kind of know what is the end game, and looking forward, what else to expect. And when this legislation was made, that's been 12, 13 years ago, and I think that with all these rules that we're looking to make, that at times, new things come up and things change, and that's kind of part of our purpose here at MLAC is to kind of look at things and make sure that things are up to date. We change language, we change processes. We as the times change. And so I would imagine that this coming forward with wanting to add the bladder cancer is, because more people are starting to have it, and they did find that 10% increase in firefighters to be getting the bladder cancers. And then with the female reproduction part, we're looking at this as kind of an equity piece, because I'm glad that we are looking at that, and there has been current events that has helped bring this to the attention of a lot more people and looking at fairness. And so I think part of this bill has to do with fairness. That doesn't necessarily have a ton of data points behind it, unfortunately. And as I view myself as a pretty lay person as on this board, and my understanding coming into MLAC was being able to look at these policies as representatives of labor and management, and just taking a look at how what we think about the proposed legislation. We're not the politicians that are out lobbying for all this. We're just meant to kind of step back and take a look and see if things make sense, if they're fair, if they're fiscally responsible. And I know, looking back on the great impact that the cancer presumptions have had for the people that get the cancers, this has been huge. And thankfully, we haven't seen a huge financial impact. So except for those people who got the help. And so I kind of view as looking at making the movement forward with adding the bladder cancers, adding the female reproductive cancers, as making things more fair for females in firefighting, and then also just providing that little bit more coverage for those people who do end up being greatly affected by the job that they chose. And kind of speaking to those data numbers, as firefighters, the likeliness of there being, potential fire victims in a fire is pretty low. But our duty that we sign up for is to put ourselves in harm's way, and to take a chance, even though the statistics are low, that there may be somebody trapped inside that building, but we still move forward and take a little bit of a risk to potentially have a big impact. So I think that by adding the bladder and the female reproductive cancers, I think that we're taking a risk by not being able to have a ton of data to support it, but I think that it would have a really big impact on the people that it would help. So thank you guys for listening.
Thank you for that very personal commentary. Very important. I saw that Carl Koenig had raised his hand first, but I would like to focus on committee members and discussion. That is the section we have. And so I'll turn it to Tammy first, if that's okay.
Oh, okay, thank you. I just want to say that for me personally, I would vote yes to support 4113 if we can add the little ditty about having a review after NIOSH releases their information. And there's precedent for that, because in I think it was 2015, OTLA had presented us with a attorney fee bill that we approved, and we requested every 2 years that it be reevaluated. And so based on previous precedent, I would say that it would be very appropriate to ask that after NIOSH releases the information in 2024, that that information be re-reviewed. It might result in zero changes, or it might result in changes, and that's my personal opinion, or where I would support. Okay, thanks. That's all. And thank you, Jill, for talking to us.
Thank you very much, Tammy. Yeah, thank you very much, Tammy. Marcy, I see that you have your hand raised as well.
Yes, thank you. Good morning, everyone. By no means do I pretend that I have a clear understanding of obviously all things MLAC, but I went back and looked at the statement of purpose and values for MLAC, and I think about my own environment. I work in a very male-dominated field, and we don't have a large number of women to even compare some things to. So I really had to pull myself back, and I would just say that we can't predict. We don't know what's going to happen. We don't know what the next great wave is. We've all survived this pandemic. But what I would offer is that I think there's an element of doing the right thing. And as we continue to try to encourage people from underrepresented communities and to have opportunities to pursue careers, the thought that, hey, there is a likelihood that you're going to have an increased exposure, and then we're going to leave those folks hanging. And so I would just ask that maybe it's not always as data driven as we would like, but I think our sensibility of doing the right thing has to weigh in. Thank you.
Thank you very much, Mercy. Any other comments from the committee members? I think I just would like to weigh in a little bit, if you don't mind. Just my own personal perspective on it. I have, for over almost 25 years now, managed local government risks and kept track of workers' compensation and funding for it, and having cities and counties bind together to fund for risks such as firefighter cancer presumption. And I'll tell you, I was in Colorado when the bill was passed. I came to Oregon, and the workers' comp program at CIS was in jeopardy, and it is no longer in operation. Certainly, firefighter cancer presumption wasn't the thing that drove it to not be a viable concern anymore. However, it is a impactful thing to local government that try to band together to self-insure. And self-insurance is a very cost-effective way to manage risks. And although, cancer claims have not been as impactful as was worried when they first went into place. When we see the statistics, there aren't that many of them. However, it was impactful in trying to find reinsurance coverage. It made it more challenging, and it made it a little bit harder for local government to have a viable self-insurance fund. And I was very touched by the testimony from the Special Districts Association, which still has a workers' compensation pool, and can feel for their plight as they try to provide a cost-effective workers' compensation solution for cities and counties, the management side, which is local government as well. So that's just my own personal perspective on it. I do agree with the comments that Lynn made and do have support for lots of it, but I would encourage there to be consideration of the very important, the big distinction is presumption. I mean, cancer claims are covered even now. The difference that we're trying to make is to make them presumed to be covered. And so, I don't know, that's my opinion that I'd like to offer. And with that, I see Sarah also has her hand raised. So.
Sorry, I was worried about my hand. Thank you, Patrick, and members of the committee for everyone's thoughtful comments and consideration. I just have a question. We've heard from the labor side that they would like the presumptions to be included. Would they consider, or would Representative Graber consider amending the bill with the studies to be relooked at when the NIOSH studies are available, and to have presumptions possibly change at that point based on data?
I think that's a question for the Labor Caucus. I don't know if they feel comfortable to speak without, caucusing first. Scott.
I think we'd want to caucus before a big discussion on what any kind of amendment would look like, and if we would be in support of that, because I'm kind of hesitant to sort of introduce that formally in legislation and tweak with things on that. I do want to say I do really appreciate the the framing of this issue this way of discussing it as a sort of flexibility and stability issue, of kind of combining what I've heard from, Jill talking about the the stability and certainty of, always going in even when you're almost certain that you're not going to find anyone in the structure fire, that you go in anyway, and have that kind of support for the people who are doing that work as well. There are very few that are brave enough to do that. That there would be. They can count on the workers' compensation system just as we count on them. And I do think that the flexibility issue is interesting. Talking about the NIOSH updates, I think I'd be really interested to revisit that and discuss that and talk about that at a future date when that's available. And I think that would be interesting to see how that evolution has changed. I know, working in construction myself, I've seen the evolution of building materials that are going into construction. When you're tiling a shower, the way that you do that now, as opposed to the way that it was done even 20 years ago, has changed remarkably with the materials that are used. And I would say that a lot of those materials are a lot more cancerous nowadays than they used to be. We're not using asbestos anymore, but the solvents and other things in the paints and the sealants that are used, when they have cancer warnings all over them when you're using them as a construction worker, but I can only imagine, when they all burn, that there would be problems there as well. So yeah, but I think that's an interesting point. I see a couple other hands up, so I'll temporarily yield to them while I continue to ponder.
Okay, thank you, Scott, very much. Tammy, did you have a follow-up? Yes.
I was going to say, because I got to get ready to step into this job site. Scott took basically everything I was going to say, so a great job there. But yes, I support and definitely appreciate all the testimonies as well too. And like you said, we want to protect the firefighters, and I have a lot of faith in NIOSH. I work in construction. It drives a lot of our industry for the better, from building material to employee safety, etc. So I have a lot of faith in those survey samples and a lot of the testing and things that they do, and a lot of sampling that they do as well. So I'm echoing basically Tammy's standpoint and everyone else in terms of supporting that, and the NIOSH as well, though. But NIOSH and OSHA kind of hand in hand, and a lot of their studies in workplace safety and things like that drive our industry. So, but like I said, I'm going to step into a job site right now, so I got to get ready to get off. But I just wanted to say that.
Thank you. Thank you for interrupting, and thank you very much for those great comments. All right. Be safe.
Will do.
Yeah. All right, Tammy.
You just got the job site, to be safe, since that's what we're talking about. That's what we're talking about here.
Okay.
All right.
Is it my turn?
Yes,
okay.
Tammy.
So I agree with what Marcy said. We need to do what's right, and everything that Scott and John said as well. And I'm not saying that I think that if we have to wait until 2024 or 2025 when NIOSH enters or issues their results, that we're going to make changes then. I'm saying that it's precedent for MLAC to order a study to be done after NIOSH publishes the results. And then the people that review that study, they can decide if changes are needed or not needed. I don't think that we can say we want to study that and make changes in 2024 or 2025 when we don't know what those studies are even going to say. But NIOSH, when they publish the results, I don't know if it's going to be at the beginning of 2024 or 2025, but MLAC can order, I'm not really sure the right terminology, Teresa can tell us, that a study be done, or a community forum, subcommunity forum, to look at that once those results are issued. And I would love for that sentence to be put right in House Bill 4113, and then let's vote yes. That's all. Thank you.
Thank you, Tammy. Sarah?
Another consideration is we could consider sunsetting House Bill 4113 in 2025, which will then can be relooked at on all angles based on the data.
Another consideration, thank you. Margaret, I see your hand is raised.
I know that you want to concentrate on what committee members have to say, but I personally, as a committee member, am very curious as to hearing Carl as soon as we could, please.
Okay, all right, well, thank you. I was going to wait. There's been a lot of interest among committee members. I think we've heard from everyone that's on the line. And so does anyone have objection to hearing from stakeholders? And I see one has their hand raised or others. Is there any objection from anyone? Okay, I hear none. So I thank you, Carl, for being so patient. And we are, I'll turn the floor to you to make some follow-up comments.
All right, thank you, Mr. Chair. To Lynn's point about NIOSH studies, is we fully support that. With this committee's moving on gynecological cancers and bladder cancer, we would certainly stay away from any more presumption language until we could all agree on what the data says. That's not an issue for us. We're actually using the same data to use to make different arguments right now. So I think everybody trusts NIOSH, both on the labor and management side. We think that is a comprehensive way to go about it. To Sarah's sunsetting of stuff, I think that well, on first blush may sound like a responsible thing to do. I know timelines in regards to bill implementation and then having it sunset on a particular day and then have something go crazy wrong at the federal government scares me, frankly. So I don't know that we could support that. Tammy, thank you for your comments. We want to be data-driven on these presumptions. We've waited 13, almost 13 years now, and we want to make sure that all the due diligence and all the 5 factors that are in front of MLAC are adhered to, right? So there's balance and affordability and flexibility of system, and I think, frankly, this proposal meets that. But I am certainly not against going for using the NIOSH study when completed to derive future discussions about the presumption. And we can work with the drafter of the legislative proposal 4113, Rep. Graber, and see what we can do in regards to committing to that on paper. But she's not here, so I don't want to mess with her bill without having her be here. But look, we're the ones who are affected by this, and we would urge your passage if we were to get to a place where you felt comfortable as a board moving this forward. And thanks for the opportunity to comment. And everybody's comments, really, Tammy, Sarah, everybody, Lynn especially. And let's go get it done. And by the way, as a closer, today is National World Cancer Day. So it would be very symbolic if this group could move on this, get it done today, and have a nice press release that we're taking care of those who take care of others. Thank you.
Thank you, Carl. That's a nice way to end your comments. I see a committee member has their hand raised, so I'm going to turn it over to Ms. Duckfall.
Thank you, Patrick. This is a question for Carl. Carl, could I see your face? Thank you. It's nice to be able to look at who you're talking to. What if a sunset went out further so there wasn't a time lapse issue? Like a future date years in advance?
I just think in general, that might be too far reaching, frankly. I don't know, sunset in materially on bladder and female GU, or presumptions as a whole. We're certainly not going to do that, just in principle. But I do feel like committing to the science is something that we have no problem getting behind, and we really are a profession of honor and our word, and we do what we say we're going to do. We're going to look at the data and meet with all stakeholders, comp carriers, you guys, the legislature, and say we'll do what makes sense.
So if the data doesn't support it, you would be willing to remove a presumption?
I'm not for overturning the presumption at all. If we're going to look at cancers, specific cancers, and there's an overwhelming piece of that data, not right. I don't want to argue preponderance or any of the levels of the presumption. I don't think that that's the charge of this committee, frankly. And then it sends a bad message to our female firefighters too. I mean, a big part of this bill is equity, and how do we address that, right? And be fair, we're trying to draw more women to our profession. We've been somewhat successful, but we're never going to get to 50.8% like the rest of the state. But wouldn't it be nice if we got to 15 or 20? And we're currently at 7. I don't think we need to create occupational roadblocks that one sex gets one level of care and another sex doesn't. I think that is absolutely destructive to any of our equity goals we have in place. Like I said, we're not afraid of the data or anything else. Frankly, our comp carriers have an economic interest in not having a presumption laden like it is. So we're workers, right? And remember, we have to get cancer to get the presumption. It's not like this is an awesome thing. This is just merely taking care of the people, like I said, who take care of others. And I've been in that role. I know what that's like. I've been in many fires, and a paramedic longer than I was a firefighter. So taking care of people is something that I've done for a long time. And I know we can't take away stuff solely based on data. That we have a moral responsibility here also. And we try to articulate that the best we could without being threatening or grandstanding or anything like that. Just a matter of fact. And I know I've had relationships and discussions with many people on this board, both management, labor, and the other side of the stakeholders on this, and we fundamentally disagree on where the presumption's at. We're not trying the presumption here. We're trying to add to the presumption. So that's kind of our position.
Sarah, was your hand still raised from your first question, or?
Now, if I could follow up, just a final with Carl. Sorry, Scott.
Is that okay, Scott?
Okay. I don't think anyone wants anyone to get cancer ever. So that is a point I think anyone and everyone will agree on. It's just the issue of presumption and where it falls. So I think we're in agreement on that, Carl. So thank you.
Okay. Thank you, Sarah, for that clarification.
All right, Scott, so you have your hand raised.
Yeah, I would say I'm not really interested in sunset or any kind of sunset on that. I think that would throw a real wrench, especially on female reproductive coverage and folks entering into an industry and trying to commit to a career, and then having the potential for that being kind of yanked out from under them, through any number of reasons, whether it's a political hiccup or some issue or a walkout or something like that in the legislature that they're then not able to address the issue. I think that would be really risky and concerning for insurers to be able to plan for that with things as crazy as they can be. I wonder, is there any kind of feedback? I don't know, Teresa or someone, are there sunsets used in workers' comp legislation otherwise, or is there any kind of presumption against that? I would think it would be difficult to structure.
There is precedence for sunsets. As if for recent memory, I can't think of one that comes to mind. But I may suggest another approach based upon a bill that the department had introduced in regards to self-insured insurer groups. In that provision, the workers' benefit fund had to be used for expenses, and then the bill also included the requirement for the department to present to MLAC, and MLAC made the decision in regards to whether to change the statutory floor for the amount of the WBF. So that might be a compromise too, is that like if the NIOSH study at a certain date, that could be the point for MLAC to review and discuss these provisions. So that
Thank you, Teresa, for bringing up that option. I see no hands raised. Oh, go ahead, Scott, please.
Yeah, just follow up. I think that I'd be much more interested in sort of us committing to review it or having a more formal review of all of that. I think that I'm very interested in and open to tons of discussion about that. But yeah, I would be very, very hesitant for any kind of sunset, especially in a workers' comp perspective.
Yeah, and I should add too, on top of that, so when, for that example, when MLAC made the recommendation, the direction was for the department to get legislation. So if there need to be statutory changes, the committee can ask for DCVS to go forth and get that legislation introduced and shepherded through.
Okay, I see Mr. Koenig has his hand raised again. I will yield to him for further comment.
Mr. Chair, the proponents of this measure, we can certainly agree to two things: examining the data when available from NIOSH, and that we will not bring any more cancers to MLAC without that thorough vetting of that data. So much as Administrator Van Winkle mentioned, and we can make that part of the legislative record. Also regarding the bill, if you were to pass it and then it moves through both houses and signed, is it will make it part of the legislative record. We're not interested in any more cancer presumptions other than the two listed here until we can vet the NIOSH data.
Well, thank you for that. That sounds like an offer. Lynn, it started with you. Did you have any further comment about the offer just laid out, or?
I think it would be a good time for both sides to caucus and for the co-chairs to get back together thereafter.
Yep, I have had that request to me directly. Is there any other comment before we do so? I see Carl's got his hand. Is it still raised, or do you have another comment, Mr. Koenig?
No, I was going to comment. My hand was tired from being up. I do not have any questions, Mr. Chair. Just a slow lower hand function. All
right. Okay. Thank you for that. All right. Well, we will, upon it seems like it's unanimous that we will take another pause and caucus. Is 10 minutes enough time again? It wasn't enough time last time. Should we make it 15 just to make sure?
Yeah, I'd say maybe 15. I know we had a ton of technical difficulties last time, so I think we have that ironed out now. But I'll be in touch with you shortly, Patrick.
Okay. All right. So 15 minutes, 11:35 on my clock. That makes it 11:50 that we would reconvene. That's only 10 minutes left in the meeting, so hopefully we can get back in time because the scheduled end time is moved. So, all right. Well, I will go ahead and call the meeting back to order, and thank you for time to caucus. And I would ask the committee members if anyone would like to make further comment or even a motion. Jill.
Thank you, Patrick. Well, I think that was a very good meeting that we just had, and I would like to propose a motion.
All right, good. Please do.
I'd like to move to approve House Bill 4113 with the understanding that MLAC will thoroughly review the data from the NIOSH study when it is complete, and that the legislative record will show that there is no intention to bring another presumption until that NIOSH study has been put out. And that's the motion I'd like to make.
Okay. All right. Well, thank you, Jill. Is there a second to that motion?
I will second the motion. However, I want to make sure that Carl said that he would go back to Representative Graber to put it right in the bill that the study is going to be done when NIOSH releases the results. So if Carl goes back and that sentence is added into this bill, then I second the motion.
All right. Sarah, I see you have your hand raised as well.
I just wanted to make clear that MLAC would review the results of the study, and it would go through the legislative process, again, through a recommendation based on those results.
Mr. Co-Chair, I have a question. I tracked down the particular bill that I was referring to earlier and the specific language that dealt with MLAC doing the study. Would that be helpful for members if I put that in the chat for you to look at as an example?
Yes, please.
Okay.
Yes, please.
Okay.
Mr. Chair, it's Carl.
Yes, please. Please, I was going to call on you.
Okay, well, look at me, somewhat of a seer. 656-790 allows the review of charges MLAC with that ability to do studies on comp issues. 656.790. So to Tammy's point about an amendment, I believe that we were, and I was responsible for making sure Rep. Graber stuck to the terms, which means as part of the legislative record, the firefighters would not bring any further cancers until the completion of that study and or conclusions of that study. Is that agreeable, Tammy? That's what we were talking about, as opposed to bringing an amendment forward on the bill itself. And because you have the 656-790 language.
Obviously you can't put it in the bill that you don't have any plans to bring anything else forward. We like that on the record, and that's very appropriate. But I think that it, we've had prior issues where we've said, like, every 2 years this is going to be examined, or the information that Teresa said. So to have just that one sentence that after the NIOSH results are issued, MLAC will review this issue.
As part of the legislative record, you as a body can do that anytime you want without legislative approval or changing the law, and I would encourage you to do so without us having to process a -1 amendment. We're committed to this 100%, and I don't know how to say it any more clear. I think the -1 does provide does kind of ask the question without asking the question. It seems unneeded. But you've heard what I said. I would turn it over to the members of the board and see where they're at. But I thought that's what we were agreeing to, not to would be.
Thank you, Mr. Conant. Tammy. You're still muted, though. Tammy, you're on mute.
Stupid. Okay, sorry about that. I would love to. I would love to hear, like, either from Benjamin, Debney, or maybe Andy Graham, one of the two gentlemen, to chime in on a sentence adding a -1 amendment or not. I see they're both here. Andy, Ben, either one, or Kevin even. Oh, here comes Andrew.
Tammy. Certainly adding some sort of statutory language to the bill that would confirm that MLAC is going to re-review this is something that would ensure that that gets done. Carl may be correct that there's authority in the statute for MLAC to review things, but that doesn't mean that it will be done unless there's direction from the legislature for it to be done. So, does that answer the question?
I think so. It was helpful for me as well. How about you, Tim?
Yeah, that did answer the question, and that's why I think that we are wanting that one little sentence to be added, -1 amendment, to ensure the fact that it does get done. Thank you.
All right, I see Scott has his hand raised, and I don't know if Carl's got it held up or if he had a comment as well. I'll let you took it down. Okay, great. Scott.
Yeah, so I mean, I think I'm 100% committed to the review because I'd like to review it just to have the data and that kind of analysis anyway. If that's not enough, like a commitment from all the MLAC members on labor currently, then I would say if Carl is okay with that as a -1, I don't know if that would have a fiscal impact or anything else, or if there's any other mayhem that would be involved in putting that in the actual law itself. Would be my only concern, but I am committed to an MLAC review of it. Absolutely, I think that would be great.
Thank you for that commitment. I think that is something that the management caucus felt that it should be added into the a statement into the law. That was pretty something that when we caucused. I don't know, Jill, would your amendment address that, or would it need to be amended? Your motion that you made to have it actually included in the legislation?
That may be a good Teresa technical question as far as if I need to amend my motion. Teresa, could you give us direction on that?
If I didn't write down I'm looking at Kara because I did not write down your specific words. I believe you did not state that it was going to be in a bill. You made the motion that you would support it with these conditions. You did not state that it was going to be an actual amendment to the bill. So yeah, I would, to be on the safe side, I would restate it though, just because of the nature of the vote.
Okay, and I guess, do we need to have that specific -1 language in front of us? And if so, I would.
You do not.
No. Okay.
So it can. What can happen is so for example, we'll use another bill. If there needs to be an amendment, you would state you would support it with the bill to be amended for this particular item. Like if you needed to strike, remove a section, something like that, on Carl's side too. Actually, I want to follow up too, not to go too far tangent with what Carl was saying in regards to MLAC's part. He is correct. Yes, MLAC can take up issues on their own, and MLAC also can take up issues that are directed by the legislature or the governor. So there have been times in which MLAC has done studies for legislation directing the Workers' Compensation Division do rules, etc., via request. So I just wanted to throw that out there. I hope I didn't confuse you, Jill.
Did you have interest in amending your motion then, Jill, to state that it would be something included in the bill? I think the MLAC review would be what would be included in the bill.
Yes. Yeah. So I can make an amended motion. I noticed that Tammy had her hand up though, kind of before we got to this point. So we want to hear what she has, wants to add also.
The only thing I was going to add is that in my second of her motion, I had seconded that I second the motion as long as this was added. So if she makes that motion to include a -1 amendment, I second that motion again.
All right, so we'll start. Yeah, we'll start. Right. Yeah. So Jill, if you can restate your motion.
Okay. So I would like to make a motion to support House Bill 4113 as submitted, with a -1 amendment that would address MLAC reviewing data from the NIOSH report in regards to cancers. Let's see, and also with the understanding that MLAC will thoroughly review the data from the NIOSH study when it's complete, and that the legislative record will show that there is no intention to bring another presumption until then.
Great. All right. Well, thank you. Tammy, do you second that motion?
Yes, I do.
Thank you. Thank you. You got the easy part. Thank you for doing the hard part, Jill, and saying it all. It sounded good to me.
Want to say it correctly.
All right. We have a motion and a second. Is there discussion on this motion before the MLAC committee? Okay, I think we've discussed it enough, so I will call for a vote. All those in favor of this motion, please indicate by saying aye.
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 Any opposed, say the same. Hearing none, the motion passes unanimously. Thank you very much. I know that we are over time, but I really want to pause and congratulate us all and recognize that we accomplished something pretty hard. A presumption is a hard thing to agree upon, and I feel like it's something we should celebrate that we were able to come to agreement. So a little pause for that before we move on to our next issue, which is House Bill 4138. We don't have enough time to really thoroughly vet it, but I understand that there is a comment that has been requested to be made by Mr. Towers. And I see he was on camera, so I'll let him turn it over to him.
Great. Thank you, Co-Chair Priest. I appreciate the opportunity to comment very briefly. So yesterday we received a proposal from MLAC management on House Bill 4138, and it's something that we've really been hoping for. That proposal provides a basis for negotiations that ought to be very productive. And in that, as part of that proposal, there's a request that we agree to discuss workers' engagement in their medical care, and we can definitely agree to have that conversation. In fact, I'd urge us to get after that pretty quickly here, because if we're going to get something ready for 23, then it's going to take some work. So we're excited about the conversation about workers' engagement in their medical care and access to care in general. And again, just we appreciate the willingness to address the problems for which 4138 is the solution. The last thing I want to ask, though, is we received a similar, not quite identical proposal from the insurance industry Wednesday in terms of setting up the negotiations and conversations about how to hammer out what seems to be relatively narrow differences at this point. Is it best to work back through you, Mr. Priest, or should we continue working with the insurance company?
I feel as though I guess I'll ask the members of the caucus. You know, I feel like we're in good communication with our stakeholders, and we trust that they will. You know, we had asked you originally to work together, so it seems like if you're able to continue to do so, that sounds like a very positive development. But we stand ready to continue the dialogue directly if that's a better approach, because we want to see us move forward. I'm really happy to hear your comments that the proposal was well received.
Yeah, it really was, and I feel like there's some again, this will be a negotiation, it'll be a conversation, but a lot of stuff we agreed to, a lot of stuff, or a few things that we're like, okay, explain why we need that sort of thing. But it'll be a conversation that I think will be productive. Thank you.
Great, thank you. Thank you for being so diplomatic about it. All right, any other comments or questions on this bill before we? It sounds like it'll be a good discussion for next week. All right. Is there any other business to be brought before today's committee? Scott, I see.
Just real quick, I'm really excited. I think we've made tons of work and progress here, and I want to thank everyone on MLAC for that. I feel like this is really, what this committee is about, and I'm excited to be a part of it.
Thank you. I am too. Thank you very much. Nice comments. Anyone else? Carl,
Mr. Chair,
you have your hand raised.
Yes, sir. Does this body have any objection to us putting out a press release on National Cancer Day, World Cancer Day, that MLAC unanimously approved the House 4113 with amendments?
I can't unanimously make that recommendation, but I can ask everyone here. Does anybody have an objection to it? Yeah. Everyone is given a thumbs up.
Okay.
And so, yes,
I will somehow
do.
work that emoji into our press release. Okay.
Okay. All right.
All right. Thank you very much for your hard work on this. I really do appreciate it. Thank you.
You bet. You bet. All right. Administrator Van Winkle, anything else?
No.
Okay. I guess I would adjourn the meeting. I don't think I need a motion to adjourn the meeting. So with that, thank you very much for a little extra time, but I think it was worth it.